low sex hormone binding globulin will be there, no? So there will be more free androgen or more free testosterone will be there. So these testosterone, this hyperandrogenic environment will not favor ovulation. So ovulation will be hampered, and this FSH-LH ratio will be also hampered by the estrogenous hormone. So the negative feedback will be there. So our treatment should be aimed at these two levels. We usually give medicines to correct the ovarian volume, to correct the ovarian function, and all. But we had also, to get a better result, we had to start medicines on these two levels. So first we had to advise the patient to cut excess sugar, excess carb and all. So then and also advise the patient to do very good exercise, especially a good cardio and like 30 to 40 minutes good cardio. So exercise will reduce the insulin resistance. So the main pathology is like it is solved. Then we had to give medicine to support the proper liver function. Then proper sex hormone binding globulin will be production will be corrected. So we had to give medicines to correct the liver function. We can give Arogya Vadani, we can give Padoladi and all. And for correcting insulin resistance, we had to advise the patient to correct insulin resistance. Like in a pre-diabetic stage, we can give like the Nishagata Katika Shayam and all, along with the medicines to correct the ovarian function. So then we will get a better result in managing PCOS. So usually we will get so many type of PCOS patient. Like sometimes the patient may have all the three symptoms. They are having like hyperandrogenism, like they are having excess hair growth on their face, their cycles is irregular. When you are doing ultrasonographically, the ovarian volume is high. So all the three symptoms are there. So they are classified into phenotype A or frank PCOS. Sometimes when allopathy doctors, they like when the patient comes with you the prescription, you can see frank PCOS. They will written like that. So if all the three symptoms, the hyperandrogenism and ovulatory dysfunction is there, then it is phenotype B. Like that, we can see so many variety of PCOS patients, sometimes lean, sometimes obese, sometimes with all the three presentations. So depending upon that, the Rotterdam's criteria is mentioned this type of phenotypes in PCOS. So hyperandrogenism means there is excess androgen production in the body. As a result of this excess androgen production, certain clinical pictures we can easily get. One is hirsutism. Hirsutism, we all know there is excess hair growth in specific areas. So if in specific areas only, like if there is hair or like male pattern of hair all over the body, then it can't be considered under hirsutism. So hirsutism means a specific like the conversion of terminal hair to vellus hair in these specific 9 areas. Then only we can consider it under hirsutism. So usually this pilosebaceous unit, that is this hair follicle, no. So they are very much sensitive to the androgen level. So when the excess androgen is there, so the normal hair gets converted, it gets more pigmented, it gets more thick and all. It is completely converted into this new like thickened hair. Next is insulin resistance. Insulin resistance we had discussed now. So the body, even the cells are not taking up the proper insulin. So they are not like accepting it as insulin. Like that we can say. So if insulin is not like if it is not utilized by the cells, so then there will be more glucose will be there. So it will be more deposited in the liver and all, and also in the it will converted into fat cells. So obesity may result. So even the PCOS, if we are advised the patient to reduce weight, they find it very difficult to lose weight because the mechanism is already like altered. So it is somewhat a difficult task for them to lose weight. Along with medicines, we advise proper exercise and all, it will be easier for them to reduce. And also in every PCOS patient, try to do a fasting blood sugar level. So if and also do an HbA1c level also to see whether the how the insulin resistance is there in the patient. So acanthosis nigricans also, sometimes we can see the patient, we can see the pigmentation of the on their neck and all, we can see that the patient is having this acanthosis nigricans, no, the pigmentation over the neck area, sometimes on the axillary region, sometimes on the like the folding area of the arm or in the popliteal fossa and all. Very much pigmentation, dark velvety type of skin. This is a visible manifestation of this insulin resistance. So either the patient may be in a pre-diabetic state or the patient may be in diabetic state. So along with the like prameha aushadhi, along with the PCOS management, we had to give prameha aushadhi to control this condition. So usually the patient may come to you with menstrual irregularity. Sometimes the patient may have like amenorrhea for like 2 to 3 months, or sometimes they may have like, or some patient may have like medicines to induce the menstrual bleeding and all. Or if menstruation occurs due to this unopposed estrogen, because there is no ovulation, no, so the progesterone is not there. So because of this unopposed estrogen is there, so the endometrial thickness becomes so thick, so the patient is having like severe bleeding. When menstruation, of course, there will be severe bleeding will be there. And also we can see some patients even like 2 to 3 months of amenorrhea. If their menstruation occurs, there will be spotting only. Such type of cases also we can see. So there is some difference in each and every patient. So we have to understand the condition of that particular patient, then we can give the medicine. So in this PCOS patient, because of, as we had discussed now, because of the altered FSH and LH value, proper ovulation is not taking place. So a lack of ovulation or even infertility issues we can see. So in some lean PCOS patients, we can see PCOS with in a lean patient. So in that case, we can say that it's purely a genetic factor, maybe reason. So in such cases also, we can see compared to an obese patient, there will be less insulin resistance, there will be less this acanthosis nigricans or hirsutism and all. The obese PCOS, they are having more this menstrual irregularities, hyperandrogenism, and also they are having more acanthosis issues. And so compared to lean PCOS, the clinical presentation is more even in obese PCOS. So investigation we had, as we all know, the body mass index, HbA1c and AMH. AMH level will be much higher in PCOS patient. It will be more than 6 or 8, something like that. We can see normally it is like 2 to 4 is normal, but in patients with PCOS, the AMH level will be much higher. So along with our medication, we had to properly correct the diet and lifestyle. Then only the insulin resistance and the liver function will be corrected. Then only our medicines will act properly. Especially that when the insulin resistance is reduced only, then only the liver function will correct. Then only our medicines will act at the level of the ovary. So if the patient come to you with like the patient is having like absence of menstruation, so our first aim is to induce menstruation. So if the endometrial thickness is correct, so endometrial thickness should be minimum 8 millimeter, no? So if the endometrial thickness is correct, then we give medicines to induce menstruation, then menstruation will occur. But if the thickness is less, if the thickness is like 4 or 5 millimeter, then we don't give this treatment to induce menstruation. First to give medicine to correct the endometrial thickness, then give medicines to induce menstruation. So to induce a cycle, we can give some Agneya, like Agneya also, which are having an anandromana property. Like we can, if it is a mild PCOS, and then we can give Saptasaran Kashayam with Hingvajadi or like that we can give. Or we can, if it is like a little bit more, we can give Kanashatahwadi, then we can give Chitragranthyadi. So if the patient is like more Pitta Prakriti, please don't give Chitragranthyadi and all. And also we can give Tilak Kashayam. Tilak Padam, we can advise the patient to prepare at home also. And also, if not possible, we can advise the patient to buy some black sesame seed with this jaggery and a little bit of hingu, and advise the patient to grind it in a mixie and advise the patient to take 1 or 2. Then also will induce menstruation. And if the menstruation has started, just tell the patient to stop this medicine in order to prevent excess bleeding. Sometimes there is a high risk of developing heavy menstrual bleeding. So when the menstrual bleeding has started, advise the patient to stop taking this medicine. Sometimes the patient may continue this medicine throughout the menstrual cycle. So that also we had to advise the patient. We can give like Panchakolasam, Kumariasam, Abhayarishtam, Vidhanataram Kulika, Kendarvastadi Kashayam, all or even Kulatadi Kashayam, all have having a property to induce menstruation. Or if the endometrial thickness is less, then we can give like Dadimadi, Sharavari Kritam, Sukumara Kritam, etc. We can give to for correcting the proper endometrial thickness. Then it will be easier for to develop or to get menstruation, or even a good Udvartana will stimulate this menstruation. And if we fail with all this medicine, we can admit the patient for an Udvartana for 5 to 7 days. Then definitely menstruation will occur. Then if the patient is having so the patient has started menstruation and the patient is having heavy bleeding, so in this phase only we are doing a pitta shamana line of treatment. In this other time we will do only a vada or kapha shamana line of treatment. So in this phase only we are doing a pitta shamana type of treatment. So in such cases we can give like pitta kashayam, trayam dyadi, usually musali kadradi kashayam, pushyanakam tablet, or shadavari kritam, pravala basmam, stipulon, point capsule, or we can give like for a proper clotting there is calcium and this iron is needed, no? So along with the medicine also check the hp level and all to see to especially if the hp level is much less, then the medicine won't act. So in between the cycle we had to correct the hp, we had to correct the cause and all. So the commonly used medicine to reduce the ovarian volume, to correct the ovarian function, we can give this Kanashadavadi Kashayam, Varanadi Kashayam, Sukumaram Kashayam, we can give Saptasaram Kashayam, or Saptasaram Kashayam with Sukumaram Kritam, we can give a Pipalya Dhanvasana Thailam, we can give Kulatadi Kashayam, Tilakwadam, Chirvilvadi, Kendarvastadi Shatharanam, Ashokarishtam, Kumariasam, Pulinkoyambu. Kanchanara Kukuru is having very good effect in reducing the Grandhi level, or like hyponet, some patent medicines like hyponet, all are having a very good action in correcting the ovarian function and also help to induce the ovulation and all. So along with the medicine, diet and lifestyle is also must keep that in mind and advise the patient also. So even after like menopause also, or even after the menopause, or even the even after like if the patient is if the PCOS is not corrected, it may complications like infertility, or even it may cause the recurrent pregnancy loss. Okay, so the quality of the egg is affected. So if the quality of egg is affected, there's an increased risk of abortion in the first 3 months. So if the patient is like trying to conceive, do a very good shodhana and all, that also before like getting conceived, do a preconceptual care, do a proper shodhana, then advise the patient to have to conceive. And also after the menopause, especially after menopause, there's an increased risk of diabetes, hypertension, like we had discussed the endometrial carcinoma, and all there's a complication. So it's a lifelong complication, it's a lifelong issue. Yeah, even after menopause, the issue won't subside. So advise the patient to follow diet and lifestyle throughout her life. Next is fibroid. So fibroid is one of the common benign tumor. It is developed from smooth muscles. It usually affects in 20 to 40% of women. Most of the time, it is like symptomless. If the patient is having heavy bleeding, or by routine examination, or like an infertility evaluation, then only the fibroid sometimes will diagnose. Otherwise, sometimes the patient may have like some pressure-related symptoms, some heaviness in the abdomen, especially in the perimenopausal period or the premenopausal period, heaviness in the abdomen, or sometimes like a recurrent UTI. So there may be a compression to the ureter. In such cases, we will usually come to diagnose the fibroid, or it is one of the major cause for hysterectomy. Sometimes the patient may come to you telling that they were having heavy menstrual bleeding. They were advised for a hysterectomy. They are like 45 or 46 years. They want to, they want the symptom to reduce and to, like, they don't want hysterectomy. So, is there any possibility that we can subside the symptoms up to the menopausal time? So that may, if some patients may come to. So if the fibroid is large, if it is causing like compression to nearby structures, then it is always better to advise the patient to a hysterectomy. Or if it is like a heavy bleeding and all, we can manage up to an extent. So some of the risk factors for developing fibroid is early menarche, increased age as age advances, and if nulliparity, if the lady is not conceived in 35 or 36 years, then there's an increased risk of developing fibroid. So there is more exposure to estrogen. This fibroid is having a very favorable atmosphere for this hyperestrogenic state. So you can see cases with fibroid with PCOS, or PCOS subjects are having fibroid issues. So one thing we notice is that fibroid patients with PCOS subjects with fibroid, they are having the fibroid may grow very fast. They are having a large fibroid. But in endometriosis patients also you can see fibroid, but their fibroid will be size will be less than 3 centimeter only. In patients with fibroid, you can see large fibroids and high fat diet, because the Kapha Prakriti subjects are having more chance of developing fibroid. There is high fat diet, vitamin D deficiency, depression, then the hypothyroidism, the metabolism is all altered. So Kapha Prakriti subjects are having a high risk of developing this type fibroid related symptoms. So, and also if we are giving medicine to fibroid patient, advise the patient to avoid this type of cause risk factors, like avoid high fatty food, avoid and check the vitamin D and correct the vitamin D deficiency. We can supplement vitamin D, some C square tablet is 6,000 unit if we are giving weekly tablet. So if we advise the patient to take one tablet in a week, so 6,000 units should be needed. Otherwise, we can give small units in alternate days and all. So fibroid usually develop from a single cell. It's a monoclonal tumor. It develops from a single cell with the deposition of extracellular matrix. Start to grow into a fibroid type of structure. So depending upon the area where the fibroid is, usually the fibroid develops from the uterine muscle only. It develops from the uterine muscle only. But when it encroaches into the cavity, then it is known as submucous fibroid. When it is pushed out to the of uterus, then it is known as subserous. And if it is stay inside the uterus, that is an intramural. So intramural fibroids usually this intramural. This is the this is the intramural fibroid. You can see it clearly here. This uterus is bulky also, because normally uterus will be up to like the fist of a hand. Normally uterus will be like this. So this uterus is bulky because there are so many fibroids in it. So if the fibroid is, if there is an intramural fibroid that is in the muscle layer, then the clinical presentation will be more pain will be the clinical presentation. So if it is encroached into the cavity, then the surface area of the endometrium is increasing, no? So the patient will complain with heavy bleeding and all. So depending upon where the fibroid is, it may cause such type of symptoms. So if it is submucous, more bleeding will be there. There will be mural fibroid, there will be vada anubandham. So kabavada shamana we had to do. So in subserosal fibroid, there will be more heaviness related symptoms because it may grow very fast. So if the fibroid is very large, it may cause compression to a nearby structure, especially to the bladder, because uterus is anteverted. No, the upper portion of uterus is resting over the upper portion of bladder. So it is having more compression. So the patient may have the urinary related symptoms will be there. Sometimes the large fibroid may compress the urethra and all. This case regarding that. And if the fibroid is late, or if the fibroid is seen near the corner of uterus where the fallopian tube is attached, so there is an increased risk of developing an ectopic pregnancy will be there. So if the patient is planning to conceive, if the fibroid is near the corner of uterus, it is better for the patient to advise the myomectomy before planning for a pregnancy. So if the patient is having heavy bleeding and all, so first during that time we had to do a pitta shamana, rakta pitta shamana line of treatment we had to give. We had to give musaligal dadi kashayam, ashokavalkala shira kashayam, pushiyana churna vidhani, drakshadi kashayam. Drakshadi kashayam churna will be available. We can advise the patient to like to drink it muhur. We like muhur panam we can advise. Lodradi kashayam, ashokashtam lodrasam, chirvilwadi, ghritam, mahatikta, all medicines if the presentation is more like if the submucosal fibroid, if heavy bleeding is the presenting complaint, then we can give this Mahadiktam, Trayandhyadi, Kanjana, such type of medicine will reduce the symptom and also the bleeding issues. And also if pain is more, if it is intramural fibroid and the patient come to you with pain, then we can give the Saptastaram Kashayam, Gandharvastadi Kashayam, Sukumaram Kritam, Hingutrigana Rasna Shutam Shusadakitam Payahab or Shira Kashayam with that. So such type of, depending upon the clinical presentation, we can give the medicine accordingly. So this the Triandiatic Kashayam, which is mentioned in Vidradi, which is having very good effect in cases of this heavy bleeding, and also like in the Kanjanara Gupulu, which is having this Kaba Medohara property, which is also having very good action in this, especially if the patient is having some thyroid issue, no? Then this Kanjanara Gupulu has action on both the system, this thyroid related issues, and also in the fibroid also it will is having a very good action. Then Ashokashtam Kumari Aswam, Arogya Vardhani Vadi, we can also give in this PCOS also, but it corrects the liver function and also it is having a very good effect in PCOS also. So management usually we can give Trayandhyadi Kashayam, like Varanadi Kashayam, Sahajadi Sevyam, Chirivilvadi Kritam, Gugulutiktakam, like Ababitta Shamana action is very good in Gugulutikta if the fibroid is large and all. Aragudarishtam, Shaddaranam. And also advise the patient to avoid this excess fatty food, this chicken, such type of food. I advise the patient to avoid all those things. Next is the endometriosis. So endometriosis, it's a patient may have like severe pain and infertility related issues. So advise the patient to it's a third leading gynecological condition which lead to hospitalization and all, and it affects the quality of life of patient, especially the patient is having pain and all. It affects her quality. It affects the quality of her life and all, and it is the one of the major cause for developing infertility issues. So we will get infertility cases more regarding the endometriosis and PCOD and all. So the peak incidence of this endometriosis is usually said to be, theoretically it is said to be 30 to 40 years, but you can see cases from 20 onwards. So it is estimated that according to WHO, 176 million women are suffering worldwide. And there are so many risk factors for developing this endometriosis. One is it's also a family related like genetic disorders. We can see like mother and daughter, you can see with endometriosis, or sisters or twin sisters, you can see. So age, it is theoretically said to be 30 to 40, and there's an increased risk in retroverted uterus, or if there is any genital flow obstruction is there, or if more number of days of menstruation, there is higher risk. And also there is an increased risk in altered immunity. So usually like it is mentioned that theory of retrograde menstruation is a cause for developing endometriosis. Retrograde menstruation means when during menstrual cycle flow, the menstrual flow occurs from like the menstruation may flow out through the fallopian tube into the cavity, into the peritoneal cavity. So it may be the reason for developing endometriosis. It is a Samson's theory. So in 90% of ladies, at some point of their life, they are having this retrograde menstruation. So only subjects with altered immunity develop this condition. So immune related issues may be also one cause for developing this endometriosis. So while treating an endometriosis patient, we had to give medicine to improve her immunity. That also we had to keep in mind. So early menarche, like late childbearing age or late pregnancy, all may contribute to the risk. So depending upon the site of endometriosis, it can be classified into endometriosis externa and interna. Interna means inside the uterus or in the like in the musculature or the myometrium, that is adenomyosis. Or it can be outside means it can be anywhere, even in the remote sites or even the eyes, anywhere it can be, or in the like extra abdominal, even in the lungs and all. So there are some common areas usually are the ovary, the pouch of Douglas, and the bladder. So these are the fallopian tube. These are the common areas for developing the endometriosis. So the theory of retrograde menstruation is the retrograde menstrual flow as a result of this matrix metalloprotein is 9 is there. It disrupts the endometrial cells, which help the macrophages to phagocyte it. So if there is a defect in this matrix metalloprotein is 9 and all, the phagocytosis will not take place, or it may be cause for developing endometriosis. So altered immunity is also one major factor for developing endometriosis. So when the endometrial this tissue, that is where we all know endometrium means the presence of functional endometrium in sites other than the uterine cavity. Functional means it can be stroma will be there, endometrial glands will be there. So these endometrial glands and stroma, they are very independent. They start to produce the estrogen. They have the local estrogen production, and they have more receptors than the endometrium. They have more estrogen receptors, so they will grow very fast. So they will have their own angiogenesis or blood supply. They will erode into nearby structures or erode deep into the tissues. By that, they will cause like they have the cyclic growth and shedding, which cause the local inflammation will be there. So the patient will have more prostaglandin production, and the patient will have more severe pain during menstruation. And the body try to make the inflammation in a particular area. So there will be more adhesion and all, because the body try to prevent it to further spread. So more adhesions will be produced, and as a result of this endometriosis, there will be inflammation will be seen. So the most common site of developing endometriosis is the ovary. So 17 to 44% of endometriosis patients are having this ovarian endometrium. So one thing, when we are doing an ultrasonography, even if the endometriosis is seen in the ovary, so ovarian endometrium or chocolate cyst will be developed. So it will be visible in the ultrasonography. Otherwise, if the anatomy of the uterus is altered, if the fallopian tube is like, or the ovary just like adherent to the posterior surface of the uterus, or the anatomy is distorted, then only we can understand this endometriosis in the ultrasonographically. Otherwise, small implants will be there. It won't be visible in the USG and all. So this ovarian endometrium, when the implants start to grow in the ovary, there will be a fibrocystic cover will occur, that it will cover the chocolate cyst. The chocolate cyst will be formed by the this fibroreactive tissue, or sometimes it will develop from the ovarian cortex itself. So the fluid start to accumulate inside it, and this ovarian endometrium will start to grow in every cycle. Every cycle it start to grow. So sometimes there will be a leaking of tarry fluid, and it may cause peritoneal pressure. The patient may have severe pain and all. Or if the endometrium or chocolate cyst is large, then it will be cause torsion to the ovary, and also there will be increased risk. It affects the normal blood supply to the ovarian also. So the clinical presentation will be definitely, it will be severe pain and abnormal menstruation. Abnormal menstruation means the patient will have severe bleeding or brownish spotting sometimes throughout the cycle, or like 2 to 3 days prior to menstruation, or even after menstruation, they will have brownish spotting. So that may be the abnormal menstruation, the clinical presentation you will get. And of course, infertility will be one of the clinical presentations. So chronic pelvic pain, the patient have like pain throughout the cycle because of the local inflammation, because of the adhesion will be there will be throughout the pain. So, and this pain is there because of the most prostaglandins. There will be more thromboxane will be produced as a result of local irritation, and all the patient will be have pain. So in such type of cases, we can give like more of like pitta shamana, shodhara type of medicines we can give. Like if we are giving like nirgundyadi, mahatiktakam, kuduchiyadi type of medicines, or even gopi chandranadi, gugulu, panchavalam, such type of medicine will reduce the inflammation, punarnavadi kashayam, or all are having effect or to reduce the chronic pelvic pain. Next is the patient may complain to about you with dyspareunia. Dyspareunia means deep dyspareunia, they will tell, because of if the implant is seen in the uterosacral ligament or in the pouch of Douglas or in the rectovaginal pouch, then the presenting complaint will be dyspareunia. So this pain will be more like a few days prior to the menstruation. So if a patient come to you, tell you about dyspareunia, there are mainly so many causes. Like if it a pelvic this PID or this endometriosis may have deep dyspareunia. Superficial dyspareunia, if they are having like a menopausal lady, perimenopausal lady, they are having this less lubrication or vaginal atrophy, or even ladies with less estrogen production or dryness of vagina or inadequate lubrication, vaginismus, all are having superficial dyspareunia. So we had to differentiate that. So menstrual irregularity, usually they will present with heavy menstrual bleeding or like spotting. Such type of presentation will be there. So in between cycle, we can give like Trayandyadi or even Avivati Churna will also reduce this pitta type of pitta shamana line of management. We can give good result. We can get good result. Then adenomyosis also, sometimes when you are doing a USG, you can see bulky uterus. The uterus will be bulky. It's one lab, it's one ultrasonography finding. So bulky uterus you will get in adenomyosis, and also in fibroid uterus you can see this bulky uterus. So in such case, in this adenomyosis also, that is endometriosis, which is seen in the uterine musculature. That is adenomyosis. In such cases also we will get severe pain and heavy bleeding. These are the two main presentation we will get in adenomyosis. And also the pain usually subsides slowly after menstruation. That is one typical sign of this adenomyosis. Next is infertility issue, because as related to this pelvic inflammation, adhesion, the normal pelvic anatomy is distorted. So the normal ovulation, even in endometriosis patient, even with if they don't have any chocolate cyst or ovarian endometrioma, the normal ovarian function is always altered when endometriosis is there. So the normal ovarian or ovulation will be absent, or if ovulation is happening, the fallopian tube will not pick up the ovum. So such type of reasons may be a cause for infertility. And also if of course, sometimes fertilization, of course, the endometriosis affect the implantation molecule. So improper implantation will not be take place. So there are so many factors for developing infertility in endometriosis patients. So when we are doing a management, usually the Vada Pradhana treatment we had to adopt. So depending upon the symptom, like if there is more bleeding, if there is more adhesion, like that we can advise like more. If the more bleeding related issues is there, we can give like Vada Pitta Shamana line of treatment. If adhesion related issues are more, then we can give like Vada Kaba Shamana treatment will be more. So thus depending upon the symptom, we can advise like dysmenorrhea is there, dyspareunia is there, this. According to the symptoms, we can classify it under Vadiki, Udavartani, Paripluda, Rektapitta, and this Vadika Pradara. Like that, we can classify. And also, we can adopt like Vada shown the line of treatment in this condition. So, first thing is Vada Shamana is main line of treatment. And internally, we can give this common medicines like Sugumaram. Sugumaram Kashayam is better. Sugumara Kritam is not advisable, especially for Snehabana and all. Sugumaram Kritam is not advisable for endometriosis, even if they are suffering from infertility. It is having some action to improve so it will increase the endometriotic cyst. So better avoid Sugumara Kritam for Snehabanam in endometriosis patient. We can give Chiriviluadi Kashayam, Kindarvastadi Kashayam, Mahatiktakam Kashayam with Kanda Suburam is having very good effect. then Hingwachadi Churnam, Gugulu Panchapalam Churnam, Gopi Chandranadi, Guluchadi, we can Kashan, we can give it as a toyam also. Virejana we can give, Avipati Churnam we can give, Virejana in Mrudu Shodhan also we can give, or also in Shavana Mata like 2 gram with honey in alternate days we can give. Arishtam also like the another Arishtam Punarnavasam, all are having effect to reduce the inflammation and pain. So if we are opting for Grida, we can give this Dadimadikritam, Kalyanagam, Tiktagam, even we can give Mahamayarana Thailam or Madhuveshtya Thailam in order to reduce the pain. And we can also give this Vasti with this Mahadaranam, Madhuveshtya Thailam. It is also having very good effect in reducing the pain and all. Next is premenstrual syndrome. Premenstrual syndrome means some of the mood swings or some symptoms which occurs prior to menstruation, especially 5 to 10 days prior to menstruation, as a result of this higher level of vasopressin level and what. So some patients may come to with premenstrual symptoms. Some may have more Vadika type of lakshana like anxiety, back pain, fatigue, like pain, shirashulam, or some patient may come to you with migraine, especially like 2 to 3 days prior to menstruation. Such a type of symptom like Vadika type of lakshanas we will get. So our line of management should be Vada Shamana. We can give Danudaram Kashayam, Drakshadi Kashayam, Maharasnadi, Shadavari, Adika, Kulam we can give, Kalyana Gratam we can give. So if some patient they are having like very much of Paitika type of lesion, they are having like hot flashes, they have mood swings, irritability. So in anger, such type of patient we can give like Pitta Shamana line of madam, like we can give Tiktagam, Mahatikta, Kasham, Ishti Madhuchurnam, Shari Bhadyasvam. We can give Talam with Kachoradi, Churnam and Shira Bela Talam. We can, it will reduce the stress related issues and all. If the patient is having like more of like depression, tearfulness, bloating, some patient will gain 1 to 2 kilos prior to menstruation. So in such type of this Kabba Lakshana, we can give Ashan type of medicines we can give. So next is the vaginal discharges. So normally vaginal discharges will be there, no? So usually 1 to 4 ml will be, if third day will be there will be secretion. So the secretion is from the Bartholin's gland or thin, and it is odorless only. That is a specific pattern we can see. And there will not be any itching, there will not be any burning sensation. So in physiologically, there will be excess secretion we can see in pregnancy, and during sexual contact also there will be physiology like excess secretion will be seen. Otherwise, there will be only mild secretion will be seen. So the abnormal vaginal discharges, if it is seen, we had to ask about the color, the smell, and the itching is there, and all or the pain or any burning sensation will be there. Such things we had to ask, and we can adopt chiklisas like Univyapit, like Paripruda, Paitigi, a type of Slaishmiki type of chiklisa we can adopt, or we can adopt chiklisa like Jwaram, Krimi chiklisa, Pandu chiklisa. So if there is anemia, show the chiklisa we can give. Prameha Aushadhi, if there is like more of candidal type of infection we can also give Prameha Aushadhis also. So if there is more itching and all, we can suspect if there is Kaba and Bandha is there. So examine if there is a discharge is there, try to examine the patient and like look for any tenderness in the quadrants of the abdomen, especially in the iliac fossa and all. And also look for the vulvovaginal area if there is an inflammation or like signs of like itching or like scratching. Sometimes the patient will scratch more and we can see the scratching or like we can see the wound there. So look for any vulvovaginal inflammation is there, or like in the perimenopausal lady, look for any ectopic changes or drynesses we can see sometimes. And also sometimes while examining, we will just inspecting itself, we can see thick discharges in the vaginal opening itself we can see. So that also we can, in the first inspection itself we can see such type of discharges. So then also if we are doing a bimanual examination, we can see we can, if they are doing a bimanual examination or even in the cervix, or if you are doing a bimanual examination, that is with two hands. One hands will, these two fingers will move the cervix. If you are moving the cervix, there will be severe pain. So the cervical motion, the tenderness is positive, then we can suspect the PID related symptoms, or the patient may have like pain, fever type of presentation will be there. So anemia is also one thing we had to exclude when we are treating a vaginal infection. So if the patient is anemic, there will be more chance of developing this disease. And also about the sexual this, whether the patient is sexually active or not, whether the partner is having any infection or irritation like that, we had to ask. And also if we are giving medicine, try to give both partners, and also advise the patient to use any like the barrier methods of contraceptions during the treatment in order to prevent the recurrence. So if there is excess vaginal discharge, if the normal vaginal discharge is 40, if there is excess vaginal discharge is there, just the like the mucus type of discharge, but it is a little bit excess, that is only leukorrhea is there, then we can give medicines like musuligadra. Acne should be correct for us. Excuse, then we can give Muslikadadi Kashayam, Padavladi Kashayam, Punarnavadi, Pushyanakam, also Sravaharam, no? So Pushyanakam, Juvana with honey, we can give Shadavari Kulam, we can give like Angayanam Kaishwara Kulu. Even we can advise the patient to use a Tribala Kashayam as just to wash externally. Okay, that, or even advise the patient to do a sit swath in Tribala Kashayam, which also we can advise the patient so they can do it easily at home. So next is the candidal type of discharge. So if the patient tells you that have a thick curd like discharge, or if they are having a excess pruritus, excess itching is there, so there is kabam, no? So there is more dominant kabadosha is there. So we had to give like kabashamana type of thing, the arapadadi type of kashaya, where we can give arapadasam, or even we can advise the patient to wash with the arapadadi kashaya, or we can advise the patient to douche with the arapadadi kashaya, or sometimes that will be burning sensation. And also if the patient is having candidiasis, check the fasting blood sugar also. So there will be an increased risk of pre-diabetic stage or a diabetic stage. There is an increased risk of developing this candidiasis. And also advise the patient to cut excess sugar and cut carb and all. So we can also give like Krimik Navadi Nurkundiati, Tribala Gukulu. Tribala Churna, we can advise a slave externally. Or even if there is itching and all, we can advise the patient the Sotamadi labum also we can give. So if there is a bacterial vaginosis, there will be a white discharge will be seen, but it is not like curdy type discharge. It will be more of creamy type of discharge. And one thing the patient will tell do definitely the smell. Even before you asking, the patient will tell smell is there, doctor, like that they will tell. So and also it will increase after the sexual intercourse also, this condition will increase. So in such type of condition we can give this Arakudadi, Nimbadi, Kukulu Tiktan, Kashayam, Chandraprabha. So the Chandraprabha, Tribala, Kukulu, all are having like so anti-inflammatory type of action. Kanjanara Kukulu, Drakshadi Kashayam, which to correct the anemia and all. This it also prevents a strava and all. And also you can give this Pushyanagam Churnam also. If she is not in a menstruating phase, you can give this Pushyanagam Churnam. Next is if you are doing an examination, there is swelling, severe swelling of the cervix. You can give like spots in the cervix, like inflammation, pain. Usually the cervix is like pink color, light baby pink color. If the cervix is like a angry looking like red shade with the dots in it, it's definitely a trichomonal infection. Sometimes the patient have like burning pain also. So in such cases, we can give like Kapha Pitta Shamana line of treatment is better. He will give you better result. So if Kapha is more, we can give Shadarana. If Pitta is more, we can opt for Sudarshana type of Sudarshana tablets. So Kukulatikta we can give Punarnavasho, Shodaharam, Sravaharam. Such type of medicine will give you more result. So Trayandiadi, Gulujadi, Tiktagam, Gokshura Gokulu, Kaishwara Gokulu, Arogyavardhani Vadi. So at the end only you give Arogyavardhani in order to prevent the recurrence. So next, chlamydial infection also, there will be more purulent discharge. So purulent, when the color is more greenish, yellowish, so there will be more infection, there will be more pitta. So give like pitta shamana type of treatment, like gukulu, you can give like guluchadi, tiktakam, manjishtadi, mahamanjishtadi, chandraprabha, amrita type of medicines will give you more result. So in a PID, this is a case of PID. She's having like cervical motion tenderness was positive for this patient. You have usually the cervix will be looking this type of thing. So there is some more inflammation in this area. You can see the secretion is coming inside from inside. So there is more like there is an increased chance of pelvic inflammation is there. So in chronic PID, we can give medicines like Punarnavadi, this Gugulu Tiktakam, you can give Gugulu Panjavala Churna, you can give Guluchiadi, Padoladi, Amardotana, Hatyadi Kashayam. Such type of medicines will give more result. And better to do douche treatment with even with tribella with you can give along with tribella a small stuttam is placed there. And then if you are doing a douche, it will have more like to reduce the excess sclerum, it will have more effect. Next is heavy bleeding. So sometimes the patient come to you with heavy bleeding, but there are so many underlying causes. So first, or it may be due to fibroid, it may be due to this endometrial thickness, endometrial hyperplasia, due to anovulation, or due to adenomyosis due to endometriosis, or even due to PID. So if the patient comes to you with heavy bleeding, our first aim is to stop the bleeding. So for that, we will give like Musali Gadradi, Kushanakam, Negrodadi, Ashokavalkala Shiravagam. And if the bleeding is prolonged bleeding, then we can give Tingam Buklatilehim, Shadavati Kirtam, Vasha Swarsam, the like Vasha leaves, Saratoda Vasikano, the Vasha leaves, which is it should be like put in a warm water, then it should be grounded and take juice, like 1 to 2 teaspoon of juice with 1 to teaspoon of honey. It will also having a very good stambana effect. And Pravala Basman you can give, like Udajarishtam is like it's also having a very good stambana effect, but it will induce constipation. So if the patient is having like bowel is okay, then you can opt for Udajarishtam or Laudrasam you can give. So endometrial polyp is also one common, but I didn't get any good result for this endometrial polyp. So usually I advise if the patient is looking for fertility, then I advise to do an polypectomy. Usually I didn't get that much result, so I don't know about it. So I usually the patient is the increased risk of developing this endometrial polyp. Next is menopause. Nowadays, we'll get more cases related to menopause because people are more aware about the menopause-related symptoms and all. So, as the life expectancy of women is increasing worldwide, there are more women in this menopausal period. No, so the women are having this more menopause-related symptoms will be more. According to WHO, this absence of menstruation for more than 12 months, then only it is considered as menopause. So natural menopause means the menopause will like gradual cessation of menstruation for more than 12 months, and then attaining we consider it as menopause. Surgical menopause means hysterectomy and all. So in surgical hysterectomy, the patient will have more menopause related symptoms like hot flushes and all. But in natural menopause, there is a gradual cessation of ovarian activity. No, so the patient may not have that much menopause related symptoms and all. So, as we all know, when the ovarian reserve is reduced during the time of birth of a girl child, there will be the ovarian follicle will be there. As the age advances, the follicle will be depleted and attaining the menopause. So the one of the most hallmark sign of menopause is the hot flashes. No, so hot flashes means a rapid, intense warmth. The patient usually tell that they are having like hot fumes coming from chest, neck, and like the region. So this episode usually lasts for 1 to 2 minutes, and the patient may have repeated attack of this hot flashes. So like some patients have 3 to 5 episodes even at night. So it affects their normal sleep and all. So in our classics, we all know the menopause Yadi Panjashada Shem is the only direct reference for menopause, but there are scattered references like we can consider as ocean domain, and which are symptom which are like which have the reference which mentioned about this hot flushes, like the feeling of hot fumes from the neck, and just like that symptoms in Tumine is mentioned. So the Nanadvacha Vyadhi of Pitta, these type of symptoms are mentioned. So for a lady with hot flushes, we can give like Ishtimadu Churnam in with 2 grams with milk, or even in Himalaya they are having Ishtimadu tablet. So Abhinga with Pindadailam, it's a kind of advice Chandanasum, Shirasum, Draksharishtam, or Tungadrumadikeram for head. It is having a very good effect in reducing this type of symptoms and all. Then Shadavari Shirabhagam, or even all menopause related symptoms, we can give like Shadavari Shira Kashayam. Like if they're having like burning pain or in the vagina and all, we can give Chandra Prabha tablet, Bella Guluchi Tailam for applying externally, Shira Bella Tailam. So usually these type of medicines will give you good result in hot flashes. So the patient is having more palpitation related symptoms, that there is there more fluttering of the heartbeat, like there is an increase of heartbeat for more than 7 to 15. In such type of patient, usually it is better to exclude a cardiac cause. So you had to take an ECG, exclude any cardiac related issues, then advise the patient for like to give Drakshadi Kashayam, Jyadi, Sukumaran Kashayam, Lakshmanarishtam or Partharishtam that we can give. Then sleep related issues, sleep, because normally the psychological, even the stress related issues, or even as a result of hot flushes, it may affect the sleep pattern in menopause. In such patients also you can advise like Shirodhara you can advise, or even the Tunga Drumadi Keram for the head, or Abhinga with the Pindadaila or Pitta Shamanalaila treatment. Drakshadi Kashaya we can give. Or Shankapushpi, Shveda Shankapushpi Churna is easily available. Shveda Shankapushpi Churna, sorry, Shankapushpi Churna is available. Shveda Shankapushpi Churna is having more effect. If you are giving 1 to 2 grams of Shveda Shankapushpi Churna along with milk at bed, it is having a very good effect to reduce stress and also the sleep related issues in menopausal lady. So the next is like joint related issues like bone pain, or even osteoarthritis, or even osteoporosis related, especially in women with nowadays we can see ladies are attaining menopause in an early age like 46. Now we can see more premature ovarian failure cases are seen. So in such cases, there's an increased risk of developing osteoporosis in the later age, because after menopause there's an increased loss of bone mass, like 3 to 5% of that will be loss of bone mass. So in the estrogen support the osteoblastic activity. That is, there is more deposition of calcium and phosphorus in the bone marrow. So osteoclastic activity means after menopause, there is the reabsorption of calcium from the bone marrow. So there's an increased risk of developing osteoporosis. So that way we can give such patient, we can advise the regular exercise and activity. It supports the osteoblastic activity, and also advise the calcium rich diet, then tikta shira kashayam, panchatikta shira vasti, vaishwantam chavana prashyam pravala basvam, all support the normal to prevent the osteoporosis. Next is the urogenital symptoms. Urogenital symptoms means the patients are having like more of vulvovaginal, especially due to the deficiency of estrogen. There is more vaginal dryness will be there. There is atrophic changes will be there, and the patient may have like, if they are ever sexually active, they have burning pain after an introitus and intercourse and all. So in such patients, they will come to you with this burn line of treatment, and also we can advise a Pichu, like this even with the Shadada Udakrutam or Pitta Shamana type of medicines, we can apply as a Pichu or as a labum into the vaginal cavity, or even we can give like Shadavari or like phytoestrogen type of diet we can advise. So next is cystosis. Usually in the perimenopausal period, the ladies are having like more of this, if the patient is like pumping or sneezing due to the prolapse, especially the laxity. the laxity of the anterior vaginal wall, causing the prolapse of the bladder seal. So because of that, the patient are having, even with the coughing or sneezing, there will be like amount of urine will become. So in such type of patient, it can be due to stress incontinence, either due to a prolonged labor, or even I had mentioned there because of the repeated DNC and all, there's an increased risk of developing the cystocele and rectocele, or sometimes during because in the postnatal period, if the lady is having constipation, if you are not taking care of constipation at that time, if you are not taking care of it, then there is weakness of the pelvic floor muscles, and it may later it may have the cystocele or rectocele related issues. So it's such type of such stress related incontinence. We, if the patient is having like a cough related or symptoms like
Hello, ma'am.
advice like gyn2, and the treatment we can advise like
Hello,
that.
ma'am. There is a small lagging in the voice. Hello, ma'am. Just a minute. She is having some trouble with the internet, so we'll get back to the slides fast.